Welcome back to the show. Many thanks for staying with us. Well, the Ghana Health Service has debunked a viral social media video alleging that the new malaria vaccine is meant to make women sterile and control population explosion. This video, including another audio, has been circulating on social media warning parents not to subscribe to the vaccination. These claims, which have been described as false by the Ghana Health Service, emerged when Ghana joined Malawi and Kenya to do the trial vaccination. At the moment, some babies are being vaccinated in different parts of the country, and we'll bring you details of that. But Dr. Kwame Amponsa Chiano is a senior public health physician with the Ghana Health Service. He's joined me in the studio, and we'll be having that conversation. Doc, you're welcome.
Thank you, Gifty.
We'll be having that conversation momentarily, but let's take a look at the viral video that seems to be warning Ghanaians against these vaccines before we start with the conversation.
Ghana for mi chacha mu nyina na me pacho enne nkoma me ne obedi no vaccination a omode eba Ghana no a ebe start ani manum ya which is nyambo a wo chena omo bewo nkranketewa sa up to 6 months omo bewo omo pane sa da se nkran omo malaria omo nibio nkran nyamo mese omo la ne ngo omo pane but ade ba ko a Ghana e wo se ohun ni se ye mpinifo no omo nwene ho mmofo mo musika kakra bi no omo kasa munko ye omo ka koye me be kire wa bakosem kakra na owi a wadwene ho se sa malaria yade na na say sa vaccines no mo de ba no obema oba akwako obia in the year 2014 mnofu eko Kenya ekoka kire o mo say oh ayi bi ba yade bi aba bla 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 ntino ye ba be wo mo mpane ntino nkola emra no mo sa maya ede o mo koye so mo ngo mo pane wo mo pane wie na afi do mo ye research no wonim de ekosi ye enipa 500,000 eye ma a mo ko wo sa pane ni nyina no o mo ntimi nya o mo ngoda in o mo life. Pass me be Google na 5,000 Kenyan women has been sterilized. A World Health Organization are aware of this. Go read the news no. So I say, I just omo me pa ho ache omo pa Kenya for man and as a Kenya man ache say omo dis a enru ko wo omo mana. He say nkura ne de enya wo biem. So I say also in the year 2013 Israel Ghana for Madiata Monias Israel Ethiopia for Jew for no omo wo mo mpane omo bom kroma no omo wo mo mpane no mo nim mpane kwa no de mo akire no omo tikro no omo ngo so ti ase omo ye research no so mu se no Israel for no ese omo bom kroma mo dodo into omo start wo mo mpane bia omo ni ama omo so no mo nim mpane kro at the end of the day no pane na si omo kwan omo ntimi nyede enwo which is 130,000 Ethiopian Jews who Israel omo ntimi nyede enwo so ti ase omo sterilize omo.
So essentially what he says is that he starts by saying, you know, with some pleasantries, and says they understand that there's a vaccination program ongoing here in Ghana, but they want parents to be vigilant. They want parents to disallow it, and these are the reasons. He says in 2014 there was a similar case in Kenya. There was a similar vaccination program in Kenya, and after that about 500,000 women became sterile. They said he also says that there was a similar incident that happened in Ethiopia, and that in Ethiopia about 130,000 Jews, according to him, also became sterile. Now let's have a conversation. Let's hear from the Ghana Health Service. What is the Ghana Health Service position on this? Is it true? Is it anything that we should take seriously at all? Dr. Chiano, you're welcome to the show.
Thank you, Gifty.
So first of all, because we've just played the social media video, this video that has been going around on social media, and I believe that the Ghana Health Service is very well aware of this video, I'd like for you to respond to the issues that he raised. How do you respond to this?
So, yeah, good afternoon to your cherished viewers, and let me first of all thank you for giving us the opportunity to talk about malaria. First of all, vaccines save lives. It is interesting to hear people who do not understand vaccination exercises talk as if they are experts. Unfortunately, that's where we find ourselves. Specifically to what he was talking about, I don't want to repeat those negatives. There is no vaccine that sterilizes anybody. Vaccines save life. So coming to the issue of the malaria vaccine, this is a vaccine that was tried in many countries, including Ghana. So we are at a stage where we are doing what we call pilot implementation. The vaccines have been tried already including, Ghanaian children were part of the trial. That ended in 2014. But normally after you have done a trial, when you present the documents to the regulatory agencies, there are two things you do. You either scale up, you just introduce a vaccine in the general population, or you do what we call a pilot. In that case, you do a phased introduction. That is what we are trying to do. Because traditionally we give vaccines in children from at birth, 6 weeks, 10 weeks and 14 weeks, 9 months and 18 months. But the malaria vaccines are starting at 6 months. So it's out of the traditional vaccination schedule. And so you are learning lessons from whether the people, they need 4 doses.
Why is it out of the usual vaccination period? What's any special schedule? Why is it? Is there any special reason why?
Yeah, because of, before you come out with a vaccine or a medication, you'd have known the dosing schedule.
Okay.
So the dosing schedule that gives a maximum protection is 6 months, 7 months, 9 months, and 24 months.
So that's when the child is 6 months, they take they go for the vaccination at 7 months. So that, which is 1 month after the first one, you take another one, and then 2 months after you take another. I want to get deeper into this so that we can have a better understanding. But I want us to clear this doubt that's created by this video, because one thing you need to be aware of is that this video is in a local language, and you're looking at vaccination. Most of the time the targets are in the remotest part, because that's where people are exposed sometimes to mosquitoes. Now, if you have somebody who's communicating in a language that lots of people can understand, the likelihood that their message will go down better than yours is high. Yes. So we need to deal with this and clear it out. So, he talks about the 2014 Kenyan incident. What do you know about that?
Well, in 2014, it's a long story, which they've come to debunk. In 2014, there was this myth about a vaccination program that was supposed to be for women, tetanus. As you know, tetanus, when people get pregnant, they get 2 shots of vaccines to protect the unborn child from tetanus. In 2014, or even before that, Kenya did what we call a vaccination campaign. Normally, you look at the data, previous data, and see if you have a lot of tetanus cases. That means your vaccination program is not, the routine one is not probably going well. Therefore, you do a mass campaign to protect the unborn, normally the unborn children. Of course, it does also protect the pregnant woman as well. Unfortunately, some people started with that kind of assertion that it was tainted with infertility medicines, which was not true. And so by the time they got to know that all the things they were saying were false, the harm had been caused. And we don't want to get to that stage. And
how do we know that those assertions were false? Who proved it false?
Oh, there were several agencies involved, including UNICEF, WHO, the Catholics in Kenya. Even it became a political issue. And so when they tested, instead of testing intact vials, they tested open vials, which people had contaminated. But normally when you are testing a vaccine, you test the one that is unopened, because that's the one that is you are yet to give.
What about the Ethiopian incident you refer to?
Well, Ethiopian is not about vaccination at all. I don't have details of that, but there was no vaccination exercise in Ethiopia. If it will be anything at all, I'm sure it will be a family planning issue. It's not about vaccination. There was no vaccine in Ethiopia that...
So let's come
people
back to...
confuse vaccines with other medicines. And even when he was talking about whether people have malaria or not. Vaccines are not for people who have the disease.
It's supposed to prevent it.
Correct. So that tells you that he doesn't really understand.
Well, not necessarily. The fact that someone may have a genuine concern.
Yes.
Because of lack of information. Someone may have the genuine concern because of experience, because of what they've seen happen before. But the
difficulty we have is that if you don't have if you don't have information, you seek for the information.
Well, that's an indictment on the part of the Ghana Health Service, because then it means that the information has not been properly communicated, so people don't have the information.
You remember on April 10th, we did a press briefing. You remember? You see, false news travels faster than real news. Otherwise,
no, but this is about health. This is about health communication. And I've done a little bit of when I was doing my MA, I did we do communications about, for example, I was studying how Ebola was dealt with. Okay, so in health communication, there is a deliberate attempt to get it to the grassroots, the people on the grassroots. So you use, for example, local radio stations.
Exactly. That is what I was going. That's what I was going to go to.
So tell us, to what extent? What's the communication plan for the Ghana Health Service?
Vaccination exercise is actually not nationwide.
Okay.
So the concentration is in the districts and the regions where the vaccination is going on.
Why is this not nationwide? Is it because it's a pilot?
Yes. Pilot, you don't scale up.
But at the end of the day, you are looking to scale up and go nationwide.
And that is when then you do the...
So you don't think doing the communication at this point nationwide is important?
We are doing that. It's very important. And so we are doing that as well. Okay. But as I was saying, it's more concentrated at the local level, where community health nurses, the nurses, health workers, including volunteers, other stakeholders, district assembly, and so on, they are all part of the process.
So how are they also dealing with this information that we're getting on social media, the campaign that's on social media?
Yes.
Some of them have really built their, they have arguments which they've really built them up. How are the people at the local level talking to the people dealing with this kind of information?
Yes, so there have also been several other audios and videos that, is giving the information better. And this
done by the Ghana Health Service.
Yes, not just Ghana Health Service, Ghana Health Service, and then.
Okay, let's get into what you were telling me about the process, the entire process, this new vaccination process. You were telling me about how it's done. So 6 months after a month after the first vaccination, you go for another shot, and then 2 months afterwards, you go for another. What are the side effects? What are the known side effects?
Okay, so from the clinical trials, the known side effects are not too different from what we know about other vaccines like measles and all the other injectables.
Share with us.
Of course, people might have a fever. That's a body becomes warm. Then there's also the issue of, because you are giving an injection, there may be some swelling. Okay. People may have vomiting, reduced appetite, and so on. But these are side effects, or what we call adverse events, that are known to be associated with quite a number of the injectable vaccines. Because what vaccines do is that they mimic the disease so that it excites your body system, the immune system, to react. So it's as if you have the germ there, but in this case, the germ or its component, it's attenuated so that it doesn't give you that
What's
kind
the meaning
of
of attenuated?
It is reduced in terms of potency.
Okay.
So your body itself mounts a mechanism to protect you, and in so doing, the temperature might go high. You may feel like you have some nausea, especially for adults. But of course, the children may refuse meals for about a day.
I think it's the only known side effect of these.
These are the common side effects. And normally, when you have a vaccine, when you are doing a trial, you don't have a lot of people. So you may have a rare event that we have never ever seen. And that is why when you are introducing a vaccine into a general population, you still do what we call a surveillance on adverse events, because now you are putting it in a larger population. So things that were very, very rare, which probably will happen 1 out of 100,000, because you did it in, say, a few thousand, you may not see. Okay. And so when we do that, we also monitor when it is in the general population.
What have you realized so far based on what you have just told me?
We have just started. We started on the 1st of May.
So you
don't have data. It may take about 6 months or 1 year to get that kind of a large number of people.
How many people are you looking
We are looking at approximately 120,000
120,000
per year.
Yearly?
Yes, yearly.
And you're doing this over how many years?
For the next 3 years. That is the pilot phase. And depending, normally you may not even end the pilot, and then you may scale up based on the lessons that you learn from the pilot itself.
When they also make the accusation that Ghana has taken some money from these donor organizations, and so the moment they excite us with a little bit of donation, and then we go doing all of these, how much money are we getting from
Nobody
the donor
gets
partners?
paid for that. No, vaccines are free. Normally the government buys vaccines We are supported by, I don't know if you've heard of Gavi. It's a vaccine alliance that supports government to buy vaccines. So these are the donor groups that support vaccination exercises. Nobody gets paid for a vaccination exercise.
Okay. What should people expect going forward?
So we would, as it were, give more education, and we're expecting that caregivers will send their awards, because we have done, I think the last new vaccine we introduced, we did a lot of research before, and what the mothers tell us is that they know that we would always bring them something that is good, and we know vaccines save lives. And
are your children vaccinated?
Yes, if I had the opportunity to get vaccinated myself, I would have done that. But unfortunately, when routine vaccination started, I was quite a boy, so I didn't benefit.
I see. So I mean, I'm talking about.
My kids are vaccinated.
Your kids,
yes, but
you have younger kids.
I'm
talking about vaccination, the malaria vaccination, not other.
No, I don't have younger kids.
You don't have younger kids. You have
this
any
is for
family
6
members?
months. Yes, I have family members
who have been vaccinated.
I have, let me say, nieces who have warts who would be vaccinated in those areas.
Very well.
Yeah.
Well, say very big thanks to you for coming. And hopefully, I was asking earlier about the communication plan, and I'm not sure
the communication
if you
plan,
that
as it were,
well enough.
It's there. We have a national plan. Then there's also the region-based plans, where engagement with all stakeholders. We've done a media engagement with the parliament. The parliamentary engagement. We've done media engagement. We've done the launch, and then at the local, in the district, at the local level, the local FM stations are also being engaged.
Okay.
Then also community, those we call community volunteers. They are also supporting the NGOs, the Ghana Coalition of NGOs in Health. In fact, they are all helping out with education at the local level.
Well, hopefully this goes well enough, and there won't be any future repercussions.
That's what we are doing today.
For Ghanaian children. That has been the fear of a lot of people, especially those who are running this campaign on social media. Dr. Mponsa Achiano is a senior public health physician specialist with the Ghana Health Service. They're helping us with that conversation. Dr. Achiano, thank you very much for coming.
Thank you, Gift.